My slide. Everybody see the slides? Yep.
Yes.
Fantastic. Thank you. And now I have to figure out how to bring out my notes. So this will be interesting. Okay, awesome. So thank you for inviting me today to come speak with you guys. I'd love to share the information of what we're doing at the Indiana Department of Health and the partnerships that we're making. So we start any conversation that we have at the Department of Health with what our mission and vision is. So our mission is to promote, protect, and improve the health and safety of all Hoosiers. And our vision is that every Hoosier reaches optimal health regardless of where they live, work, or play. I will let you know, since Zoe mentioned at the beginning, there is new state leadership. We have a new governor as of tomorrow, but we are at the Indiana Department of Health. We are continuing with the same leader we had under the previous administration. So State Health Commissioner Dr. Weaver has been asked to serve again during the Braun administration. So we're really excited about that and continuing the momentum of this work. So the Health Workforce Council was created from a recommendation from the Governor's Public Health Commission, which in addition to HFI funding, the Health First Indiana funding that I'm sure a lot of you have seen in your county, seeks for ways to improve the public and clinical health workforce. It is a partnership between the IDOHA, so the Indiana Department of Health, and the Family and Social Services Administration. So we're working very closely with the Division of Mental Health and Addiction. I'm very committed to not duplicating efforts and to making sure we are doubling down and getting the most bang for our buck on any of efforts that are going on in the state, including workforce development. So we recognize that there are many stakeholders in the workforce conversation. The council hopes to provide the framework for the communication mechanism and to ensure the awareness of current programs and new and existing initiatives throughout the state. One of the things that I hear most often when I travel throughout the state is, I didn't know the state was doing that, or I didn't know that was a funding opportunity that I could apply for. So that's really what we want to do, is we want to be a place where people can gather and share those ideas and figure out how we can get more together. So the council has many goals, which you can see on your screen, but the one that I'm most excited about is the State Health Workforce Plan, which is slated for later summer this year in 2025, which will take a comprehensive look at all the information that we have been working on for the past year and getting that out into public for consumption, as well as where we are headed in the future. So stay tuned for more information about this project, and as well as additional opportunities to volunteer and contribute your subject matter experts. I will tell you a little bit about our structure. So the Health Workforce Council has 15 members representing various geographic locations all throughout the state. Many representatives from health workforce occupations, including educational institutions, employers, hospitals, long-term care facilities, FQHCs, and then also community health center representation and CCBHC representation. So really excited about that. Each council member brings their unique subject matter expert on data-driven actions with a focus on sustainable results. So the council members reflect the priorities identified through our data and stakeholder engagement, which I'll talk a little bit about in a minute. So in helping us out on this, because we could not do this by ourselves, we have the Bowen Center for Health Workforce Research and Policy serving as our research and analytics arm. So they are providing us with data and information that has helped driving policy recommendations. Additionally, we are also supported by an executive advisory committee, and this is the committee made up of members from all of our sister agencies. So on this committee, we have representatives from the Department of Workforce Development, the Department of Education, the Professional Licensing Agency, as well as the Department of Homeland Security and the Commission for Higher Education. So that's really a group of our state policy experts. And then the council is supported by subcommittees, and we'll talk a little bit more about that in a minute also. So we began this work in March, in late March and April last year, by conducting an electronic health workforce survey and holding a day-long health workforce summit, which solicited the feedback from over 200 diverse stakeholders. So we asked participants to identify what was working well in our state, as well as where we should go from here. So overall, you can see these are areas that were identified as what is working well in our state. I apologize, I have a beagle That's what you could hear in the background. I'm so sorry. Kids are at bus stops, so he's not happy, wants to go out there. But excuse me. Overall, our strong education system and quality of life factors and data infrastructure were considered to be an asset to our workforce. We also asked participants, where do we go from here? And if I can just share a story with you, when we were doing all the data research and gathering information, what was most striking to me is that behavioral and mental health came as our number one area of opportunity in the state. And it wasn't just behavioral and mental health clinicians sounding the alarm, saying we need help in this area. We need to drive a pipeline to this workforce, as well as focus on recruitment and retention. It was the doctor in the rural setting saying, I've got a 6 to 8 month waiting list for my patients to be seen by a behavioral and mental health clinician. Like, I need help, I need support so that they can reach their optimum quality of health. So that's something that was very important to us and that we wanted to make sure is reflected in our priorities moving forward. And additionally, when we said, where do we go from here? Where are our areas of opportunity? 2 areas stuck out: pipeline education and training, and recruitment and retention. And really, how are the ways that we're driving that early pipeline engagement into the health workforce, starting as early as middle school? We know that kids are already starting to talk about what they want to do at that age. And so how can we start to put those little seeds and nuggets to get them interested in these kind of careers? And then we're also looking at recruitment and retention. Are there areas that we need to give additional incentives or help stand up in the area? Or, for example, our rural areas, how can we incentivize people to go in and practice in those areas? So we've looked at some solutions for that, what that could look like as far as state loan repayment, as well as tax credits for preceptors and supervisors. So that's something that our committee is looking at as well. We have, based on all the feedback, we formed 3 subcommittees. One is looking at obstetrics, in Indiana. The other is behavioral and mental health. And then we're also looking at family medicine and pediatrics. So our group does meet quarterly, and our subcommittees are meeting monthly. So we're hoping to have some really good focused policy recommendations for our groups coming up in the next couple of meetings, as well as looking at what comes out of the legislative session. There's some really exciting bills being heard in committee. And so we're excited to put any data we have or subject matter expertise in that. And with that, I will leave time for what I think is the most important. It is questions from you guys, connections, feedback. What can we do better at the state? I always kind of chuckle and say, what can we do to get out of your way so that you guys can see Hoosiers? So I am going to share this with Leanne, and she will send it out to you after our time today. So there is my contact information. Please feel free to reach out. I love connecting and learning more about everyone. So I'm going to stop sharing so that you can we can all have a conversation and talk. I would love to hear some feedback from you guys.
Yes, what questions, items of discussion for the group?
Hello, this is Art Fuller from Hamilton Center. One question that I'd just like to ask, we know the workforce pipeline kind of begins also at the high school level. Are there things that we're doing at the state and also communicating with leaders at the high school level about the state's plans and things like that?
Great question. I'm really excited. I don't know if you guys have been keeping an eye, but the Department of Education is unveiling some new high school recommendations. And part of that is a real focus on work experience and work-based opportunity. And I think that there are a lot of great opportunities that our kiddos in high school can have, especially with our school-based counselors and being there. One of the concerns we have, I have to tell you, and our health workforce committee has discussed this, is how do we take kids that are 16, 17, and 18 and put them in our facilities, healthcare, behavioral and mental health, in an appropriate way where they can actually get experience, but again, complies with HIPAA, insurance regulations. And there are some really creative things going on out there. And we actually, one of our FQHCs up north has a really good opportunity and is doing a lot of work with this. So we want to learn more about that. We want to learn how we can scale that. We want to learn how we can implement that. But I do think that the new high school diploma requirements are going to change the way communities engage with their students like that. We are also, our behavioral and mental health subcommittee is also working with the Department of Education to look at school counselors. So that is, the Professional Licensing Association gives us a lot of information on what the health and human services licenses look like, but we don't have as much I would say transparency into what some of our school-based licenses look like. So we're really drilling down to that so that we can understand what the situations look like in school.
And just a note for that, Brooke, to kind of thread that needle, the council has been working with Bowen on that school workforce because our community mental health system is in close to 2,000 schools statewide. And so at a variety of levels of staff. And so we want to make sure that we are accounted for in that and in that pathway. So just wanted to thread that needle for you.
That's awesome.
Any other questions? Yes.
Zoe, I just wanted to add to that. One of the challenges that we've seen from a workforce perspective is just where the state or some other organization will fund behavioral health outside of a traditional behavioral health setting. And I'm fully supportive of people getting access to care where they need it. The problem is that eliminates staff in the system that already exists. So in a lot of, and they're not equitable services. So we're just seeing a lot of professional drain to non-traditional behavioral health settings like schools. And that's not sustainable long-term for the safety net system. So just something to think about as you're thinking about where to put your efforts and dollars. I'm not saying one is better than the other, but I am saying that they are not the same. And so we have to just be careful that we aren't losing staff to non-traditional settings when they aren't going to be doing the same thing, and funding and supporting that, if that makes sense.
No, that makes a lot of sense. And we see that in some of the medical field too, as well, though, that non-traditional setting. And I was just telling someone the other day, I was like, there seems to be sort of a riot brewing between some of those settings. And I do think that we're going to have some sort of conversation where we all come together and realize we're doing this to serve Hoosiers, and how is the best way to do that.
So good morning, Brooke. This is Mark Collins from the Hamilton Center. I was just curious about the behavioral health subcommittee that you spoke about and what the makeup of that committee is, the representation on that committee. And if you've already said, I apologize, I didn't catch it, but how heavily involved are individuals within the CMHC system or even FQHC system in that makeup of the subcommittee for IDOH?
So first off, we're always seeking additional subject matter interests. So if you are interested in serving in that subcommittee and have the ability to commit 1 to 2 hours a month to this goal, please feel free to reach out and email me. We are having our second or third meeting at the end of the week. And so I would be happy to get you up to speed and involved in that. And that goes for anyone on this call if they're interested. But the makeup of that committee is we have some state government representative. We also have some private practice providers, as well as some community mental health center providers and educational institutions. So really want to make sure that we're all working together and having those educational institutions involved. Like, what does the training look like? So for example, the dean of the IU social work program is a member of that subcommittee as well. So.
Thank you.
Mm-hmm.
Any other questions, discussion for Brooke?
And I just want to say that, we are working very closely with DMHA on this. So I think that it is, I have received a wonderful education. If any of you had the opportunity to work with Gina Woodward at DMHA, I had a wonderful education from her when I joined this position at IDOH. So she has been able to really skill me up. I am still learning a lot. I do not have a behavioral health clinical background. So I am not afraid to ask questions and not afraid to admit when I don't know. So you guys are the subject matter experts. That's why I would love to hear from you. If you'd like to have a conversation, you or your organization, please feel free to reach out to me. I can set some time on our books.
And Brooke, if you would put your email address in the chat, and I do know, just to kind of also thread the needle for the group, the early workforce work group, we did connect with Brooke. It was during the holiday time, so we didn't have a lot of folks show up, but the human resources individuals are, we are trying to plug them in to this effort so that that pipeline and what is being done there. With our early workforce group. So, connect to those individuals as well. For us, it's developing what that looks like to be able to have that be seamless. Like Brooke said, the concern of age and what that looks like in our world and setting that up. I know some have figured that out pretty well, but some have not. And so we need to really collectively come up with a system approach on how we can build that and plug into IDOH so that we don't lose folks, because other people are doing it. And so we're going to end up losing out if we don't figure out a creative approach to that.
And I always like to say workforce is just a numbers game at the end of the day, and there just isn't the numbers to fill what we need to fill. So how do we get kids interested in our careers to make it their passion for the rest of their life?
Perfect. Well, Brooke will put her email there. And thank you, Brooke. If you want to hang on, you're welcome to hear these updates too, because some of them probably impact your workforce space. So I'm going to go ahead and share and take this opportunity just to brief everyone. So as you know, or may not know, our session started last Wednesday. It's been a slow start. Because of how the schedule is. However, our goals and our work has not slowed down. We have had several meetings with both House and Senate budget officials and have a big opportunity with our House budget team coming up here soon. Our goal is to get our fiscal ask in the House budget when it comes out. So if you see the governor's budget come out, which is going to be any day now, and we are not in there, do not fret. What we're working is with House and with legislative folks in the House Ways and Means. So these numbers we're working to get finalized, especially around the crisis funding component. And so we're just waiting for some confirmation from DMHA. But it is a total biennial ask of $122 million for both the CCBHC demo and all of the crisis work that all of you have been doing for this budget session. We are also advocating for our line item to be changed to Community Mental Health Center so that funding goes, whether it's crisis or CCBHC, there is flexibility within that funding pot, as well as having a separate individual budget line for group home, room and board rate. And we did a lot of great work with a lot of members to come up with that. That is total for the biannual, so $21 million each year to help in supporting our group homes. And then we are, like Brooke said, tracking and supporting the community mental health workforce. Senator Kreider has put forward the social work compact bill that we are going to help to try to get to the finish line this time and support, as well as that professional standardization between each regarding clinical hours. And if you have, you need to have your A, and really streamlining that between all of the license, because in code, it all reads different. And for those at the Behavioral Licensing Board, it's challenging. So imagine how confusing that is to our workforce. So more to come on that. and also other workforce bills that will be presented. But those are the two that have come out of the gate we know are going to get hearings. And then other legislative items that we are tracking and heavily involved with are our prior authorization bill. That prior authorization, our piece in that we are working with a work group of members is ensuring that the continued care component of our care, so the level of denials that we've been seeing since KeyPro and Essentra within our SMI population, addressing that legislatively through this prior authorization bill. So as that gets shored up, we will keep you posted. Of course, you've heard in the news, both federally and state, regarding the Hoosier, Indiana plan and the concerns around if the federal government changes the percentage and how that will impact the state. We are watching that. We know how impactful that is to the lives that we serve. And as things get formulated or we know what's moving forward, we will definitely keep everyone posted. We have also, because of the leadership of Matt Burden at Porter Stark, have been heavily involved in our hospital assessment fee and having community mental health who do hospital services as their own class, and working with both the hospital association and the legislature on the best solution so that we can have that as an opportunity for those that we serve and our providers. We are, like every year, there's always defense that we play, and there has been some noise. I have not seen anything hit specifically, but there has been some noise regarding the consent process for school-based services. We will work with IFCA and our other partners to get that killed ahead of time. But if that comes up and gets noisier, I will make sure to let you guys know to raise our advocacy and our voice around that. So what to expect this budget session? As you know, a new governor was sworn in yesterday. There is new administration. So as Brooke shared, some have stayed the same, and for us, that's a good thing. Dr. Weaver staying consistent. Lindsay at IPLA is staying consistent. That's a huge win for us because of the work we've been doing with IPLA and improving the credentialing and the licensure process. Those who have changed for us, though, that are significant are FSSA. So Mitch Robe is starting in that role, and Mitch will be overseeing not only FSSA, but Medicaid. And so we have lost Cora Steinsman as that Medicaid director. And Cora, that was a strong relationship for the council since she was at the governor's office. So that one has changed. DMHA right now, Becky is staying as that director. And so we, have been working with her and that relationship, but that is what we know as of today, as well as Doug Hutzinger. His role will not be in the governor's office, but will roll up to FSSA. So as we get more information on those key, I just think it's really important for all of you, because you work with all of those folks too, to know these changes. If you have any questions or need contact information or need an introduction, whatever that might be, don't hesitate to reach out to myself and we can facilitate that. Keep in mind, we are working within a Medicaid shortfall. It has gotten better, and we are not part of that conversation. So in all of these budget conversations, this is not connected to the work that we're doing, but it will be impactful to our advocacy. Session ends, not that I'm counting down the days already, but maybe I am. April 29th, 2025 is when we have to wrap up session. So just wanted to share some of those updates with all of you because everything is happening so quickly. And when I have opportunity with members, I want to make sure you guys know what's going on from a policy front. Before I move on to a few other updates, are there any questions regarding what is happening in the public policy space? I do, because I see Beth's beautiful picture there. I do want to thank Beth Keeney and Matt Burden, our co-chairs, as well as all of our public policy committee members. Seth, I saw that you were on. Without your work and without your support, we would not be as far ahead as what we are this session and being able to connect with the individuals that we have been. So I'm just forever grateful. Our members is what drives our work. So I really appreciate your leadership. And then just some other updates. If you have not signed up your staff, our behavioral health and aging certificate enrollment is starting. It is funded by a grant we received from Humana, and it is a behavioral health and aging certificate program from Boston University. There is no cost to centers. It is self-paced and online. It is 6 to 9 months to complete if you're dedicating about 1 to 2 hours. It is primarily for OBHPs and frontline staff to be better in serving the aging population. As you know, our aging population is our fastest growing population in the state of Indiana, and mental health needs as a result of that aging population have also increased. So this was a solution that the board came up with strategically to help us in addressing is by having this aging certificate program for staff. So please reach out to Andy if you're interested. I also am forever grateful to those who are on this call for the Racial Equity and Leadership Committee. They have started a quarterly connection hub to help with racial equity and leadership topics that will also help us with our CCBHC work. It's kind of all threading that needle. Dr. Gina Forrest is a phenomenal speaker. If you guys have not heard her speak at some of our conferences, and she will be talking on culture competency this Thursday. This is also another no-cost training opportunity and open to any staff. Anyone can attend this. So please join me on Thursday to listen and learn from the wonderful Dr. Gina Forrest. And then if you have not signed up yet, rooms are starting to fill up and things are starting to get busier for us around February 10th. So this is our political action fundraiser, and we will be hearing from the attorney and political pundit Abdul Hakim Shabazz. If you have not heard him, he definitely brings levity to the political dynamics and will be a phenomenal session. If you have not made your PAC donation for 2025, that is what will get you in to this event. So please go ahead and do that so we can start finalizing actual count. And then last but not least, we need to pack the State House for mental wellness. Attendance is a little light on this, but I want every legislator, there's 150 legislators, right, to have a community mental health center member to talk to at lunch. So that means all 24 and maybe a couple more. If everyone can have the challenge of Hamilton Center bringing a bus of 30 of their staff and come to this event. This is our event to talk about CCBHC, crisis, group homes, all of those things I shared with you a few minutes ago. We need you to do that on a local level to help us with that advocacy to get us to the finish line. So that registration is there. And so without further ado, I wanted to say that Becky Glines at Southwestern is our Starbucks winner. So congratulations, Becky, for winning. And we will get that to you. And I saw this cup this morning. My wonderful team gave this to me for Boss's Day. And I thought, you know what? We all need to hear this today. It's cold and we have been doing a lot of great things, but it says sometimes you forget you're awesome. So this is your reminder. So this is for all of you on the Cup of Joe today. You are all awesome. And if there's anything we can do to help you with being awesome, please don't hesitate to reach out. Appreciate all of you and have a great day. Take care.